Welcome to Body Activation Explorations, everybody. This is hip rotation with knee flexion. All that means is that your hip's going to spin with the knee bent. So with the journaling exercise, what do you feel? Where do you feel it? Try to get as accurate as you can with the words to describe it so that we have a good idea of how it changed. And how does it affect how you move? How's it affecting how you move? All the positions should be pain-free with no cramping. And a controlled pace, so 3 seconds spinning in and out. And we do around 6 to 12 times per side, but that's only if it's pain-free. You're going to find the position that's pain-free with the most difficult control of that motion. So that's what you're looking for, so we can create an exercise with that in a little bit. So the first position that we're going to practice in is the standing position with my hand touching the table, or you can hold on to a wall, or if you have a chair handy, that's a good thing to hold on to as well. Just anything that's sturdy enough to hold on to. And I'm slowly spinning my thigh in and out, just controlling that pace. So I feel what's going on at the hip, making sure the knee feels okay with that range of motion as well. Now I'm going to compare that to the other side. Can I bend the knee and easily rotate in and out? Does it feel comfortable? Or is it a little bit difficult? And compare that from one side to the other, because again, we're looking for that position that is pain and cramp free, not even tight, but just difficult to control. So we're going to take this from the standing position on each side with that knee bent, and I chose 90 degrees. You can have the knee bent more or less, that's totally fine. And I use my right hand to see whether or not my torso is rotating with my body. So now I'm going to go to my back, and this is the best done off of a massage table or a bed, because this way we can have our legs dangling. And if you have a bench, this is really good as well. A bench can work wonders for this one. And I keep one leg straight and I rotate the opposite leg in and out. And I keep my hands on my stomach to make sure that I do not turn my torso. Whatever I have, it's just coming from that thigh spinning right within the hip socket. And now I'm going to repeat this on the opposite side. Just again, making sure that you have everything coming from the hip, spinning within the hip. It feels secure. It feels okay. Sometimes you're going to want to sit up a little bit on this if the hip feels tight. So if you just sit your torso up a little bit off or prop yourself up with a pillow underneath your back, this can help with that. So again, protect those hips. Make sure they feel light, controlled, and easy rather than just shoving them into a position. So now I'm on my right side with my knees bent and my body's almost at 0 degrees of hip flexion, which means that if I were forming a straight line with my body, then all I do is bend my knee. I support my head with my arm to make sure that I'm in a relaxed position, that I'm not straining myself. And then I take that top leg and just rotate it up. And then I take the bottom leg and rotate it up. Now we're going to go towards our stomach. I'm going to bend the knee and slowly spin it in and spin it out. If this feels a little awkward on the hip, you can always put the pillow right underneath your pelvis, underneath your hips, to give that a little extra hip flexion or a little bit of propping the hip away from the table. So it feels a little bit better on the hip. There is usually not quite a lot of motion in this in people, but some people have a lot of motion. So it's okay to have either. It's just pay attention to whether or not it feels okay and if they feel the same in that position. So this is where the journaling process becomes very important. Now, does it feel tight as you're going through this rotation, or does it feel really good but difficult to control? Because again, we're looking for the position that feels really good, but it's just difficult to control that limb. So now we're going to finish this up on the left hip, and we're going to raise that left leg up in the air, that left foot up in the air. That is left hip external rotation. And we'll go through that between 6 to 12 times. And then we'll drop the knee right on top of that left knee, the right knee on the left knee. And then we're going to do hip internal rotation by raising that foot straight up. And it looks kind of different because, you say, well, I'm bringing my foot up, so it's got to be external rotation. Well, if you look how that foot comes up, it drives the thigh in, which creates internal rotation of the right hip. My head is supported on my arms again to make sure that I feel comfortable. Sometimes I support my head with both my arms, which is pretty nice. Feels pretty comfortable and safe and secure. Now what we're going to do is we're going to prepare our journaling entry post exercise, which is how do you feel now, and accurately describe how you feel now to compare it to when we started, and how do we move now compared to when we started. Now, in what position were you the most comfortable with? What movement was most difficult to control? Let's build an exercise off of that.